Good day. So my name is Justin Dollimont, and I'm a certified block therapy instructor and certified block therapist here in Fort McMurray, Alberta, Canada. My personal journey with block therapy began almost 10 years ago at the end of 2013 when I came across this amazing practice online. I ordered the block, I got started in my living room, and from that moment on, like, my life has never been the same. And since that time, of course, developing this practice for myself, I saw the benefit of being able to help others with it, and then became a certified block therapist and block therapy instructor back just a couple years ago in 2021. And since that time, I've been instructing classes here in Fort McMurray. We have many weekly classes at some of the most fabulous yoga and fitness studios around. And it's not only been a pleasure for myself to change my body and my health in some pretty incredible ways, but I'm having a whole lot of fun with getting this information out and sharing it with people and getting that feedback from people of how this is really changing really impacting their lives in a very positive way. And so today I'm very, very excited because I'm sitting down with Deanna, the founder of Block Therapy, the creator that's, the mastermind that's behind how this wonderful technology has come to be. And we're going to go through a series of questions. I've got some good questions lined up to ask Deanna, which I think will not only benefit myself, but hopefully benefit a lot of the people that are viewing this today. So Deanna, welcome. Thank you for joining us today. I'm very pleased that you're making the time to answer these questions.
Thank you so much, Justin. And I just want to say how grateful I am for you and all that you're doing, all that you're sharing. I just love that you entered my life, and the work that you're doing just really brings so much joy to me every day. Hearing you express your enthusiasm and the changes that people are experiencing, it's what this is all about.
It really is. And yeah, the feeling's mutual for sure. So Deanna, how did block therapy evolve, starting with your own personal exploration over 20 years ago now?
Yeah, it was 23 years ago. I was really struggling at that time in my personal life. I had been already practicing as an athletic therapist for a number of years, always focusing on deep tissue work. And as an athletic therapist, also working with athletes. And I was applying what I was trained to do to my own body, but my own body was really not responding in any positive way. The harder I was working out, the more I was trying to create positive change, I was actually going in the opposite direction. I was getting more compressed. I was getting bigger, more constipated, just more backed up. My whole system felt very stagnant. And it was very disheartening because I'm working with these athletes and I'm applying what I'm trained to do, yet I wasn't getting the results that I wanted. So when I was 30 years old, I went through some pretty significant changes in my life. And as a result of those, I started having some pretty severe anxiety attacks. And it was this one anxiety attack that really was the seed of everything to come, because in that moment, I actually was frozen in fear. I couldn't catch my breath. I didn't know if I was going to make it through the moment. So, but intuitively, I dove my hand into my abdomen. And in that moment, I encountered pain. But the pain brought me out of my crazy thinking. It grounded me essentially. But I also let out this gasp of this exhalation. And so I started just intuitively using my hands in my abdomen, just feeling around. And it was fascinating because what I was feeling was a marbling of what felt like scar tissue. So for the years up to that moment as a therapist, I was always focused on deep tissue work. So I was very familiar with what scar tissue felt like in other people's bodies and from injury or surgery. And now I'm feeling this tissue marbled through my abdomen, yet I hadn't had any injury or surgery. So suddenly I had this flood of understanding as to why my body was locked in the prison that it was locked in, because I recognized that there was no blood and oxygen flow getting to this tissue. That 50 extra pounds of weight that I was carrying was really stored and stuck in the core of my body. And I used to do 400 sit-ups a day, running, Taebo, weights. I mean, you name it, dieting. I was doing it, yet the laws of weight loss didn't seem to apply to me. So now I recognized why there wasn't positive change. So that first evening I spent maybe 30, 45 minutes just intuitively exploring. And I felt, first of all, very calm, which was a very different perspective for me because usually I was riddled with anxiety. So I woke up the next day, continued to feel calm throughout the day, very excited to get back home that next evening and continue my exploration. So I did. And after that second evening of that intuitive work, when I stood up, I felt taller. And I went and I looked at myself in the mirror, and my belly was flatter than it had looked in years, like literally. So I became so excited about this that this became my daily practice. After working on patients all day, I would come home and I would work on myself. And within 2 weeks, my chronic low back pain had very much improved, and other things started to improve. So I started to treat my patients in a very similar way that I was working on myself. And I started to gain a ton of changes with them. And then I started attracting other therapists to learn the technique. So that was the beginning of this whole journey. And for about a decade, I really focused on the technique that I call fluid isometrics on myself and on clients. But I really wanted to teach people to self-care. And I initially tried teaching people to use their hands on themselves, but there was a lot of limiting factors to that. So it was, again, an intuitive journey coming into this whole world of block therapy, where I was actually working with one of my yoga instructors, and she had me in a sideline twist over a bolster, and she cautioned me that this gets very deep and to be careful. And by this time, for a good decade, I'd already spent 10 years diving really deep into my own body with my hands. So I could hardly even feel what that bolster was doing. And very nearby on the floor was an Iyengar yoga block that I had from back in my yoga days. And I said, I want to lie on that instead. And she's like, oh my gosh, that's way too intense. And I'm like, no, I want to try this. So I do. And as soon as I did, I was like, oh my gosh, I don't need to use my hands to get into my body. I can move my body into this piece of wood to get a similar result. Now, the challenge was it was rectangular in shape. So as much as I could feel the benefits, those sharp edges limited me from really doing what I wanted to do. So for the next couple of years, I worked with one of my body workers who was also a woodworker, and we created the size and the shape that we use today for the Block Buddy. And here we are.
Which is amazing, because going into the core is such an interesting thing where you started, because the first time I laid on the block, I was amazed at how much pressure and intensity I felt in the belly. And I'd been spending, the last 10 plus years changing my diet and doing all these alternative holistic things, but I was still having a lot of pressure, a lot of constipation, a lot of issues in my gut. And when I laid on that block for the first time, I was like, oh, wow, like there's something's happening here, something really different. And I was intrigued, and that really started that journey for me. And at what point did you realize that block therapy, that this process is something really different and really beneficial?
So for so many years, I was working fluid isometrics on my patients, and my technique is a very different approach than mainstream massage techniques. So what I was recognizing in my treatment room is I would teach the client, the patient, to breathe through the process that I was doing. And then a week later, they would be coming back, and then they wouldn't be breathing properly. So I thought, okay, the very first thing I need to do is to make sure that between sessions, the client is still using that proper diaphragmatic breath, because that's the real magic in understanding how to create proper flow in the body, how to keep the fascia heated, properly aligned. And so that was the very first step that I did. And it was fascinating because, it's pretty simple. Like you lie over it and you focus breathing into it. But because pain, fear, and stress cause us to reactively hold the breath, the majority of the population are breathing through the muscles of the upper chest, the secondary muscles that aren't designed for us to be breathing all the time. So this really limits our ability to properly oxygenate the tissue. It also keeps the body at a colder overall temperature. So to really engage proper diaphragmatic breathing is the key to continuing to move forward on your health journey in a positive way. So that was the real incentive for me, was to initially simply get people to do that. But then I recognized, well, I'm doing all these other things. And so we started playing around, and people were absolutely loving the benefits. And that's how it began, probably about, over a decade ago anyway, by now.
Yeah, for sure. The benefits definitely speak for themselves.